Come dice il papà di Nicholas, Günther, è incredibile quello che la natura sta richiedendo da un corpo femminile. Ciao a tutti, sono Serena e benvenuti nel mio canale. Sono tornata, però d'ora in poi non sarò più la sola. In questo video vorrei condividere la mia esperienza del mio parto naturale. Io dico come in casa perché l'avrei anche potuto fare a casa, solo che fondamentalmente sono piena di vicini, come sapete, nell'appartamento e sto per traslocare, quindi sono piena di scatoloni. Chiusa parentesi. E vorrei parlare di come anche tu puoi prepararti per un parto naturale, per un parto in casa, se è questo che desideri, i comuni errori o le incomprensioni e ovviamente i benefici che sia tu che il tuo bimbo ne possono trarre. E farò tutto questo anche grazie all'aiuto della mia ostetrica, Morgan, che mi ha assistito durante la gravidanza, il parto e il postparto ed ha più di 10 anni di esperienza nel campo. Ho un sacco di interessanti domande da fargli, anche grazie all'aiuto vostro, come quali sono i segnali che indicano che una donna non dovrebbe partorire naturalmente e sarebbe meglio non facesse un parto in casa. Come è eseguito un parto in casa? Le controindicazioni, se ci sono, del fare l'epidurale durante il travaglio. I danni dell'episiotomia. Questo è un tema hot e quindi se ci sono dei consigli per evitare le lacerazioni vaginali. Parleremo di cordone ombelicale, come tagliarlo, aspettare, non aspettare, lotus birth, il parto in acqua, se è consigliato. È possibile avere un bambino naturalmente dopo che si è fatto un cesareo. Parleremo ancora di vaccinazione, di depressione postparto. I più importanti esami ed ecografie da fare durante la gravidanza e molto di più. L'8 dicembre del 2020 ho cominciato il mio travaglio, un travaglio che è durato 8 ore e il giorno dopo a mezzanotte 20 minuti questa meraviglia è nata. Quello che non mi sarei mai aspettata è che tutto è cominciato con un dolore menstruale, come se avessi il mio ciclo. Dolori che hanno continuato per circa un'ora e poi immediatamente sono cominciati i crampi e le vere contrazioni già ogni 2 minuti. Altra cosa che non mi sarei mai aspettata è che 8 ore, in realtà ragazzi, se non lo sapete già, è che 8 ore è anche relativamente veloce, però sembrano un'eternità quando si sta dando alla luce. Ecco, mi trovo qui alla clinica New Life e vorrei farvi vedere esattamente dove ho partorito e anche un po' come ho partorito. E scusate per alcuni video se qualcuno ha uno stomaco un po' sensibile, però questo è la verità, è la vita vera. Come dice la mia ostetrica Morgan, this life, è la vita. Quindi andiamo a vedere esattamente il mio processo. Ripeto, ho deciso di partorire in clinica perché non me la sentivo a casa per questo trasferimento, per il fatto di avere un sacco di vicini. E quindi sono venuta qui nella clinica stessa a dare la luce. Una delle ragioni per le quali ho deciso di farmi seguire da Morgan e ho scelto questa clinica è sicuramente la libertà innanzitutto di movimento durante il parto. Vi faccio vedere, io praticamente l'ho passato camminando dal letto a qui, al bagno, e ho avuto un sacco di possibilità per rilassarmi attraverso le contrazioni e anche durante le contrazioni. Ad esempio, c'è la possibilità di stendersi sul letto, cosa che non ho mai fatto perché le contrazioni erano così forti che non riuscivo a stare sdraiata. Io ho utilizzato questa fantastica cosa che è la palla e praticamente l'ho passata quasi tutto il tempo così. Le contrazioni erano così forti da subito non riuscivo proprio a muovermi e avevo questo fortissimo dolore che dal centro pelvico scaricava tipo crampi attraverso le gambe. Da questa posizione a questa posizione a questo fantastico amico, è stato veramente mio amico, il bagno, dove ho scaricato un sacco di volte prima di partorire. Sì, ho passato tanto tempo in bagno e ho anche vomitato una volta. I vagigi che non avrei dovuto mangiare, ma pensavo sarebbe durata molto di più. Anche qui c'è la possibilità di utilizzare la vasca e Morgan infatti me l'ha preparata per partorire in acqua. Se si fa un parto naturale a casa, lei porterebbe la piscina. Nel mio caso il parto in acqua non ha ben funzionato, nel senso che non l'ho sentito mio. Anche quando mi sono messa dentro e poi sono uscita l'ho sentito molto stimolante. Già avevo la testa dappertutto e per me è stato troppo. Altra cosa, questa corda che è interessante, in cui ci si può tenere per la posizione di squat. Si fa veramente tanta fatica con le braccia e l'energia va tutta sulle gambe. Però anche a me è piaciuto sempre stare in piedi o seduta su questa sedia, che è la sedia per parto, ok? E tutti questi strumenti per me sono stati molto importanti perché utilizzano proprio la forza di gravità per farlo uscire. Ecco, questo è il motivo per il quale ho deciso questa clinica, il fatto di avere questa libertà di movimento e anche questa libertà di scegliere le procedure da seguire, ad esempio come tagliare il cordone ombelicale. E il bello di avere un letto matrimoniale è anche per il post parto. Infatti Nicholas poi ha dormito qui con me ed è stato bello perché non solo dopo aver dato alla luce abbiamo messo il bambino, abbiamo messo Liam sul mio seno e l'abbiamo attaccato per le prime gocce di colostro, ma dopo aver fatto questa prima connessione tra me e lui, ho potuto darla a Nicholas che l'ha ricevuto a torso nudo e anche lui ha potuto stabilire una connessione. Vuoi uscire? E poi ovviamente, se conoscete me e se conoscete questo canale lo sapete di già, il fatto che questa struttura è in linea con la nostra filosofia, il nostro approccio, che è un approccio igienista. Noi vediamo il parto, la gravidanza, il travaglio come avere un bambino, come la salute, sono dei processi biologici normali e naturali e pertanto dovrebbero essere normali, naturali, senza antidolorifici. Il cesareo o l'epidurale dovrebbero essere solo utilizzati in casi di vera emergenza. Siamo forti sostenitori della filosofia di non interferenza, sia per quanto riguarda la salute, no? E la vita. Preferiamo focalizzarci nella preparazione di corpo e di mente. Quindi già anche durante la gravidanza io mi sono estremamente preparata attraverso una sana alimentazione, movimento, attività fisica, tantissimo riposo e anche la mente, no? Le emozioni, cercando di stare tranquilli, sereni, e quindi abbiamo cercato di affrontare tutto ciò naturalmente, con serenità e vedendolo come una cosa normale di cui non aver paura. E poco sapevamo che Morgan ha la stessa filosofia. Anche se lei non lo chiama igienismo o igiene naturale, lei è lì, no? Ti supporta, ti aiuta, però tanto quanto tu ne hai bisogno, tanto quanto ti sia necessario. E penso che questa dinamica sia anche stata la base del nostro successo. Ed eccomi qui con la mia ostetrica Morgan, la mia fantastica ostetrica, la andrò ad intervistare. Per me il suo aiuto è stato grandissimo. Non solo per quanto riguarda il processo, no? Ma anche per come mi ha guidata, perché ci sono stati dei momenti che sono stati veramente forti per me, specialmente alla fine del travaglio e per spingere questa meraviglia che però in realtà, ragazzi, ha fatto un male cane. Infatti una ragazza mi chiedeva: Serena, ok, hai fatto un parto naturale, senza epidurale, senza antidolorifici, ma com'è stato? Ripeto, un male boia. Morgan è venuta dagli Stati Uniti e da circa 2 anni ha aperto questa clinica, New Life, a Cabamba, e neanche una aloha. Hi Morgan!
Hello everyone!
Thank you so much for being here and sharing this moment with all my public. Would you like to tell us something about your background first? How long have you been a midwife?
Alright, well, I initially trained in the US and I was actually homeschooled, so it's pretty cool. I was able to start midwifery school in my last 4 years of high school. And so when I graduated high school, I then just had to do clinical. And then I worked around the US, and from there I worked in Africa, Central America, Mexico, and those areas. Currently, I've been practicing for almost 10 years.
That's pretty awesome. I said, she's awesome. I also call her the magician. My vaginal magician. So how many births do you think you delivered?
I have almost delivered 1,000, including all of the births that I had to do in training.
Were they all natural births?
They were all natural births, yes.
So by your experience, how often is it impossible to deliver a baby naturally, hence there is the need for the hospital?
Typically it's 15% of women that cannot give birth vaginally. So the rest of the majority of women can give birth vaginally with, skilled provider, someone who knows to be patient, someone who knows techniques if baby's in a bad position, someone who respects physiological birth because it is a process.
Which are the indicators then a woman, you would say, okay, she cannot do it vaginally, naturally?
Sometimes women have oddly shaped pelvises. It can be due to poor nutrition during childhood, and the pelvis is actually just malformed and misshaped, and the baby actually cannot exit through the pelvis.
So would you say that my pelvis...
No!
You said it was very tight.
I said it was tight.
I apparently have a tight pelvis, and it was difficult for me to push the baby out. The baby was super healthy, but it had a little bit of difficulty breathing. Was that my case?
No, that wasn't your case. If you had gone to a hospital, you probably would have been given a C-section because they see you pushing. It's been an hour, it's been 2 hours pushing, and they're like, we don't like this, and they would have probably done a C-section. But that's what I mean by having a skilled provider, someone that knows that this is your first baby. And also, when you are older and having your first baby, your pelvic floor is so tight. Like if you have your first baby when you're younger, it goes through there, all the muscles stretch, and it's different. But when you're a little bit older, not that you're old, but say you're out of your 20s, that pelvic floor and you're very active is super, super tight and
We're
strong.
giving off my age. I'm joking.
It makes it more difficult. And also different things depend on that. It's the shape of your pelvis, the position that your baby's head is in when it goes through the pelvis. Those are all things that determine how long it takes to push your baby out.
But I did well.
But you did well, and it worked. This is an example of how birth works when you have patience and skilled provider.
And I want to add something in Italian. È veramente importante, ne parlavo anche con il dottor Giuseppe Cocca nella nostra intervista, vi linko il video. Il fatto di cercare una struttura, delle persone di supporto che siano in linea con la vostra filosofia di come volete dare alla luce o procedere, e soprattutto avere anche persone competenti, perché so che l'ostetrica che scegliete, la struttura che scegliete saranno di fondamentale importanza. Io veramente ho avuto tanta fortuna a trovare lei, anche se poi ho molta fiducia nel mio corpo, grazie anche alle mie basi e ai miei studi di igiene naturale. Ho imparato ad avere fiducia nel mio corpo e sapevo che lo avrei potuto fare, quindi anche la preparazione mentale, non solo del corpo. Se voi scegliete di dare alla luce in ospedale, bisogna tenere in considerazione che loro hanno i loro protocolli e li seguiranno, perché per loro è la cosa giusta da fare. So what are the dangers of a natural birth, or let's say a home birth?
So recent studies have shown us that the dangers in home birth are actually less than the dangers in giving birth in the hospital. And this is mainly because in your home or in a birth center setting like this, you feel very comfortable. And when you feel comfortable, your body produces more of birth hormones. When those hormones come, labor progresses more normally and naturally the way it should. But when you go into the hospital, you're exposed to lights, strange people, loud noises, stresses. They're asking you're having contractions and they're asking you, what is your ID number and all of this stuff. And so your brain is not able to get actually where it needs to be, which is in a primal state to give birth.
It was a primal state. I screamed like an animal.
But there are dangers. Like I said, there is that 15% of women that should be giving birth in the hospital or should be getting a great intervention like cesareans. But if you look at the statistics, home birth and midwife-run birth centers actually have better outcomes than the hospital.
So, you have delivered, I know, rich babies. You have resuscitated babies many times.
Sadly, yes. Or unfortunately, rather, yes.
But what would you say it was your toughest case of these 1,000 babies?
Okay, well, I have two toughest cases. And the first was more caught me off surprise. I was in Haiti. And it was
Haiti,
yes. And it was the middle of the night. And I was upstairs sleeping. I have a little infant myself. And I'm volunteering in this birth center for a month and a half because I did this every Christmas. Someone came in, the guard said, someone is here, and I said, okay, and I sent a student down, and then she just started screaming hysterically, you need to come! And I said, oh, wait a minute, I'm getting dressed. She says, no, it doesn't matter that you're not dressed, you need to come. And so I go down there, I have my baby in my arm, and I have a bra on and a skirt on, and I have no shirt, and there's this woman, and she's standing there, and there's just two little feet hanging out of her. I was like, oh, you're having a baby! And she was only 32 weeks along.
Oh, early.
So it was premature, and on top of it, it was a breech. Come over, we delivered the baby, it needed full resuscitation, but the baby lived. And this is actually a really awesome story because we're just now in the medical field learning about premature babies and what's actually best for them. Because for a long time, they were taking those babies and taking them away from their moms and putting them in incubators, and now they're finding that they have better outcomes if the babies are with mom the whole entire time, in between the breasts where it's warm, and trying to breastfeed from the beginning. So this was really interesting for me to see because my sister had given birth to a preemie a few months prior, and they did the whole normal thing where they took the baby from her, and it was really stressful for her and the baby had to stay in the NICU for 4 weeks, and it didn't need an oxygen anymore, it didn't need anything, they just wanted it there. And then this Haitian mother comes in and has a baby at the same gestation, and yes, it did need some oxygen, and it did need to be resuscitated at birth, but then the baby did kangaroo care, which is a skin-to-skin with the mother, and thrived. And
actually, what you suggested us to do
exactly.
Immediately after the baby came out, it was immediately laid on my chest and then on my breast for the first...
Exactly. The first hour, typically, exactly. But that wasn't the most difficult case, but that was just like slightly difficult, but interesting, and also a great learning experience for me because we get to see when we embrace those primal instincts to keep our babies near us, that it actually turns out better for the baby.
And we don't interfere too much.
Exactly.
That's what I was telling. Like, you don't know it, but you have a very hygienic approach, and we have the same philosophy of the least interference or possibly non-interference at all, because the body is made for that.
Exactly.
It's millions, if not billion of years of evolution.
Exactly. But most recently, I had another breech case here in Ecuador, and this was a surprise breech. Typically, if you're going to have a breech, you would like to ideally have the mother had a baby vaginally headfirst first, because then you know that the pelvis is large enough to fit a baby through it. But because it's harder for the head to come through than it is for the rest of the body. So with a breech birth, you're thinking, okay, we want the mom to ideally have received chiropractic care, because typically the chiropractic care, the baby will just flip. But here in Ecuador, I arrived at this birth and the mom was just about pushing and it was coming bottom first. Also another thing is that you don't really want super young women because their pelvises tend to be a little smaller. The woman was only 16 years old. And so when I arrive and she starts pushing and we have the whole body comes out and then the head got entrapped. It's quite difficult to get it out, and it needed a little bit of help after birth, but all was well. But it was one of those births where you're like, we trust birth, but it's also something that has to be respected. Yeah. Because things can go wrong, and that's
to be prepared as well.
Exactly, and be prepared. That's why you want to have someone there to help you.
That's why I came to you and I wanted to be followed by you, because yes, there is a non-interference philosophy, but at the same time, I know there is a level of preparation. Sometimes things can go wrong.
Exactly.
It is life.
It is life.
So, how is a home birth done? Do you need assistance?
Typically, we have like the main midwife or an obstetra, and then we have an advanced student, and then we have another assistant. And we bring all the stuff that you found in the birth center to the home. We have blow-up birth tubs here if people want water birth. We bring the oxygen with us. We bring everything. We actually have like a rolly bag that has everything for the home birth in it.
This is an interesting question. Are there, and if yes, which are the contraindication of epidural or having painkillers during birth?
So there are a few things. There's the fact that when you get an epidural, you lose your movement. And movement in labor is the best thing, one, to ensure that your labor goes along quickly, two, to ensure that your baby and you are being able to move yourself. Because do you remember being in labor and you feel like you want to move your hip this way or your hip?
I moved so much. Yeah. I went for a marathon inside there.
And that's what helps you dilate, and that's what helps your baby get in the best position. So with the epidural, the main issue is that you can't move and you can't feel things anymore. So when it comes time to push, you can't feel that. If you had an epidural and you had only directed pushing, you wouldn't know what felt really bad. So you wouldn't know when to back off. And not knowing when to back off does your body more damage. Those people end up with tearing. Also, there are risks for the baby. Some babies actually have fetal distress from it. Some babies have issues breathing when they're born. Sometimes the mother's blood pressure drops. It definitely interferes with those hormones we were talking about, because labor builds. As your labor is progressing, your hormones increase and increase and increase, and that's why...
Like natural hormones,
exactly.
They're painkillers.
The painkillers, and they're also preparing your baby for life outside the womb. One thing with home birth and birth center babies that people find, and they always comment on, is they're so alert. Like, they come out, they've had their first 10 minutes, they've transitioned, and then they're alert. But that's not the case with these, C-section babies or epidural babies, is that they're not so alert because they're kind of drugged out.
A hot topic. So, I didn't tear vaginally, and I found out that about 80% of the women have vaginal tears.
Yeah, right up to the anus.
Right up to the anus. And I was so lucky, but not just lucky, I had support holding. That's why I call her the vagina magician. And anyway, also my public has a question. Is it a problem of elasticity, that maybe some women are more lucky and the vagina opens up easy? Or do you have any tips to prevent vaginal tears?
My first tip is diet, because a healthy diet allows your tissues to stretch. That's the first thing. And then it's also someone who's going to help you, not just because a lot of women, that head comes down and you're like, oh my gosh, this is the worst thing I've ever felt and I'm just going to push this out. And that is when you create a tear, because you're just pushing past it and you're not letting that tissue stretch. It burns. Do you remember that burning?
Yes.
That burning is stretching. And so when you're doing it slowly and you're just allowing your body to slowly push baby out, it's allowing all those tissues to stretch. But diet is huge. Diet.
Okay, I didn't know that. That's good.
Yeah, no. The healthier the tissue, the easier it's going to stretch. And then it's also the pushing. Fear. People who are really fearful for the whole birth process and they don't understand it, tense up. When you tense up, what happens? You're pushing against a tense muscle and tissue, and you're going to tear. So trusting the process and trusting that your body was built for this process, because it was.
So episiotomy is a common, normal word for a woman to know and to hear when they go to the hospital prior to birth. Are there though any damages to? I mean, clearly there are, but do we want to talk about it?
Well, it's really not necessary. Like in my 10 years and my almost 1,000 births, I've only had to cut 2 episiotomies. Literally, no, people don't need to be cut. It is better to let yourself tear the small tear that you might tear and have that tear repaired than it is to actually be cut, because that cut is way larger than you're probably going to tear. Sometimes they don't repair it correctly. Here in Ecuador, we had a woman who, they had the student cut the woman in the hospital, and then the doctor said, you cut in the wrong place, and then he cut the other side. And so then she had 2 cuts in her vagina. That if they don't suture it well, and if it doesn't heal well, you could have long-term pain. You could have pain during intercourse. It's best to avoid it. And honestly, you can tell them no, because it becomes obstetric abuse. The moment that they pick up the scissors and they cut you without asking, that is considered obstetric abuse, which is a huge thing that New Life is against, and a huge thing worldwide that women are fighting.
Nausea and vomiting during birth. When it gets too much for the woman, is there any way to help her naturally?
Okay, so if it becomes too much where the woman's actually getting weak, typically we can do an IV to replace fluids.
Just water?
We have Ringer's lactate, which is like a hydrating, and that typically women feel a lot better. Typically, women only vomit during transition, and so it's not the whole entire labor. I mean, it's a very small percentage of women that are vomiting the whole entire time, and those women usually get put on IVs. But normally a woman transition, when your body is getting ready to start pushing and things are changing, there's a huge shift in your body. You're at 7 centimeters, you're going to complete dilating from 7 to 10, and there's a huge shift, and that's when you start vomiting, because it's like a rush of hormones. So
the peanuts. Let's talk about the umbilical cord.
Okay.
That's very important to many women. What is the physiological best way to cut it for the baby? Should you wait or should you not wait? What about lotus birth? Let's talk about it.
Here at New Life, we wait until the cord stops pulsating. So usually that happens around 10 to 20 minutes. That means that all of the baby's blood is out of the placenta, out of the cord, and now in the baby. And that's about 1/4 of the baby's blood. So when you're in the hospital and your baby comes out and they put that cord clamp on there and they cut it, 1/4 of your baby's blood is still inside of your placenta. I mean, that's a lot of blood. The lotus birth, after, like I said, after the 30 minutes when the cord stops pulsating, it's white, it's flat, and then when it's empty, the cord collapses, and it kind of almost clamps itself by collapsing. So keeping it attached to the placenta as a lotus birth, there's actually no benefit for the baby.
The good thing is that here we decide as
You decide,
parents.
exactly.
For example, if we wanted to clamp it,
Exactly.
we decided to burn it, for
Exactly.
example, because we wanted to keep the umbilical cord and the placenta and dehydrate
Exactly.
it. You can also do a lower birth.
Depends on the preference. Now, if you are listening to this video and you're about to give birth in the hospital, you can say to your doctor once that baby comes out, and you can also hire a doula or somebody else whose job is to sit there and say, do not cut the cord. Let my baby get all of its blood, because legally they have to let you.
A woman in the public, she actually gave birth in a hospital in Rome. They told her that if she would have kept the umbilical cord attached, she would have bled out.
Oh, yeah, that's definitely not.
So they cut it.
Not
Is there,
sure.
for example, a risk of infection, maybe?
Well, there's not a risk of infection because the placenta is going to exit your body. Usually within that 30 minutes, you're going to birth the placenta. So then you're going to have a placenta in a bowl with a baby, with the cord, and then you're going to be able to clip it. But no, she's not going to bleed out. Unless there's a true emergency, say your baby comes out, it really needs to be resuscitated. It needs chest compressions. And yes, you're going to have to cut the cord because it's still attached to you, because the placenta is still inside of you. But she's not going to bleed out. Birth in water. Do you recommend it? Are there any contraindication? So birth in water is great. I have 3 children. I gave birth to 2 of them in water. And it's great for pain relief. Some women don't like it. Some women get in there, they think they're gonna love it, and they don't like it.
Me.
Or some women get in there and they love it and they're like, I don't wanna push in here because I don't feel like I have enough energy in here. But a lot of women give birth in water. The risks would be you give birth in dirty water. The risk is your care provider leaves your baby underwater too long after the baby's born. The risk would be you have a shoulder dystocia when the baby's shoulder is stuck and it's spending a lot of time underwater. Something like that would have to be resolved very quickly underwater, or the mom would need to get out of the tub.
And also, so if you want to keep the placenta and umbilical cord, let's say for the stem cells, you could do it even if it's...
Oh, completely, even if it's in the water.
Another interesting question. Is it possible to deliver naturally, vaginally, if the first child you had a cesarean?
Yes, absolutely. We call that a VBAC, a vaginal birth after cesarean. And it is. There are some things that make you a better candidate, which would be, it would be 18 months after your cesarean. Then you also need a skilled care provider because there needs to be a little more monitoring that's done during labor and pushing to make sure that there's no rupture of the uterine scar that came together when they sewed it. Like 20 years ago, if you had a cesarean, they would say, nope, you need to have a cesarean for the rest of your life. You cannot try a VBAC. But then all this evidence came and women were like, no, we want the right to try. And then they realized, hey, statistically this works. Like the percentage of women who actually rupture is very, very low. It's like down almost to I think it's around 2%. Giving women a chance to do this birth it usually is very, very empowering for women. But like I said, you need to have a skilled provider, and someone who actually really supports it and believes in it. But here in New Life, because the cesarean rate here in Ecuador is at 85%, we do a lot of VBACs.
With success?
With success. We've only had one that we were like, but she came from Venezuela, and I'm not really sure that when they sutured her back together, they did it properly.
So do you have any tips for women that have had a cesarean and want to try vaginally? So any tips to help them?
Join support groups. There are so many support groups. Also, you would want to eat super healthy. You want to make sure that you get pregnant for this next baby 18 months after the cesarean. You want to see the chiropractor a lot so that you can work on your pelvis and get optimal positioning for your baby. But also the care provider that you have, talk it over, talk your fears through it, because anyone that had a cesarean feels like they failed or their body failed them. And so there's a lot of emotions that come with that, and finding someone that's going to empower you to have an amazing birth is what you need to do.
So after all this, would you say that the hospital environment, as we said, with its odors and the flagos and the blinding lights, is an adequate environment for starting a life?
No, and I hope that doesn't sound biased. It's just that I've worked in the hospital, and then I've worked in homes, and then I've worked in birth centers.
Let's say you are medically trained, you can go and work in hospitals
exactly
regularly in the States.
It's just a completely different experience. Because a lot of what happens is, even if you have good doctors or good midwives that want you to have an amazing birth in the hospital, there's a lot of policies. So that changes the outlook of your birth. You're never going to be able to change the bright lights. You're never going to be able to change the fact that they want you to wear the blood pressure cuff all the time, or there's dinging things, or there's staff that you don't know. Birth is really personal. And so getting to know the person that's going to be at your birth so you feel like you have a relationship with them is important. Unfortunately, with the hospital, you get somebody different all the time. And it changes the whole hormonal process, because you had this whole process going hormonally and primally. You're like, okay, I got this plan. Okay, we're doing this. And then it's just all thrown out. And yes, it
can happen
anywhere. And yes, your birth will probably still work, but it's really nice to get to know your care provider. Oh, and also there's a lot of interventions in the hospital that happen, and they're just driven by fear. And so a lot of the things that they do disrupt your birth process because they're fearful, and they actually have not seen like true, uncomplicated, unmedicalized birth.
It's all about trust at the end.
Exactly.
Again, trust in your provider, trust in the structure, trust in yourself, trust in your body.
Exactly.
Trust. So don't interfere, just check, be prepared, and if there is an emergency, act, which is also okay, but just if there is
exactly
the actual reason for it.
If there's a real emergency that just happened because it happened, not because we created it, because we intervened. That's what happens a lot in the hospital, is that they create situations that they have to intervene in because they've created the situation. And sometimes it's the epidural. Sometimes it's the epidural, so the mom is on her back and she's dilating slowly and the baby gets distressed. All of that could have been avoided if the mom didn't have the epidural. And maybe the woman didn't have the epidural if she had gotten information on this or education on this, or maybe she had more support, or maybe she was out of the environment that pushed the epidural. Because that's part of the issues. You go in there and like, you don't want to suffer. You're in pain, aren't you? And you're like, yeah, you're right. I thought I wanted to do this naturally, but I don't. I can't do this anymore. This happens all the time. And because it's offered and they're like, yeah, just do this. It's okay. But if that's not offered and if that's not the model of care, and not because we're trying to torture women, no. But if the women were supported and empowered to be able to do a natural birth, then...
And educated.
Here
you have so many
exactly.
benefits.
Education is so huge here. I mean, people come into our clinic and they don't even know what ovulation is. Like, they know nothing about their bodies, the women here. They're not educated in any way. And so education it's huge.
How can a woman prepare best for a home birth or a natural vaginal birth?
Research and support. Information is power, and so the more information you have from people who have done it. Because if you're a first-time mom, that's a lot of fear when, grandma has her stories, your mom has her stories, your spouse has their stories, and so you really need to find people who are into what, the same type of stage of life. And once you have all the information, you are going to be more encouraged to follow through for your natural birth because you know the benefits of it.
More confidence.
It's also support of your partner too, because if your partner's like, you're killing our child by not going to the hospital, then that's always going to be in the back of your mind. So educating your partner as well.
Yeah, and also I am a believer in knowledge. Knowledge is power. We should do our research. I feel so blessed that I did take my time also in the past to learn natural hygiene because it gave me immense trust in the power, the capabilities of the human body. And also that's why I'm doing this video, to give more power to those women that want to do a natural birth, a vaginal birth, a home birth. It's possible, and I think it's so much better for the mother and especially the baby. So another question, would you say that nutrition, physical activity, for me also resting was very important, is...
Absolutely. Like nutrition and exercise are one of the best things that you can do, because people get pregnant and they often think, I'm feeding too. No, you're not. When you're breastfeeding, you actually need more calories than when you're growing a baby.
I noticed that actually.
Exactly, because just you yourself, you say you need an average of 2,000 calories. You're growing a baby, 2,500. You're breastfeeding, 3,000. If you eat well, then you're going to grow a healthy baby. You're not going to get gestational diabetes. You're not going to put on excessive weight that's hard to get off. And then if you're exercising, you're preparing, because birth is like the biggest marathon you're ever going to run. And people think, I'm pregnant, and then they don't exercise and birth hits them, and it's so much work. I mean, all these muscles you don't typically use, and then all of the rest of your body just sustaining the fact that you have to go through labor until it's done.
And a lot of women prefer to just beat the whales on the sofa.
Exactly. No, and it's not beneficial, because the more exercise you have and the more fit you are in pregnancy, usually the shorter labor you have. You know this, you had a very short labor. Yeah. I have short labors. You can't say, around the board that's going to be everyone.
But the best is to just give yourself the chance to be prepared, as prepared as possible.
Exactly.
Oh, another very good question. How to cope with the pain? For example, I didn't take epidural. I didn't take any painkillers. Actually, you don't even have any of these options here. So, what to do?
What to do for pain, okay. So naturally, there's a few things. So if you're suffering from severe back pain, you can do sterile water injections. There's about some points on the back that we can put sterile water in just under the skin. And it burns a little bit going in, but people say it really helps with back pain. You can
So sterilized
water.
Sterilized water?
Yes, sterile water.
Okay.
Do you
do
do it?
Okay.
We do it, but you know, a lot of our women don't have that much back pain because we're really proactive with giving them exercises if they come into us with chronic back pain, suggesting massage, chiropractic care, all that kind of stuff. Also, we don't have a TENS machine here, but are you familiar with a TENS machine?
TENS?
TENS, T-E-N-S. Basically, it has like a little pads that go on, and they have electricity going through them, and every time that you have the contraction, you can push the machine, and it helps you deal with the pain of the contraction.
Okay.
But I feel like women are really built for
So,
childbirth.
Yeah,
and so
all these 1,000 women just did it without?
Just did it without it, exactly. But there's also the warm water. You can get in the birth tub. That helps a lot with pain. And then there's also birth balls, the peanut ball, which we didn't have when you gave birth, but we have it now. We have the hanging rope. Some women like hanging on the rope. They said that it helps them have pain relief.
Interesting that you mentioned back pain because a woman was asking, okay, if you have chronic back pain, can you deliver naturally?
Absolutely, you can. But you would also probably want the support of hot water, a really good doula who is there just to rub your back and talk you through it and tell you can do it. And also options for when you're in labor, because if you are stuck in a hospital bed on your back because that's where they prefer you to be, you're going to have immense pain.
Yeah.
Where you would want to be able to go in different positions and move around, you probably want to push on your hands and knees so that you're not having all that pressure on your back.
Let's talk then about the benefits of natural birth.
Oh, there's so many. No.
Yeah, I think there are.
There are actually. Yes, so hormonally for the mom and hormonally for the baby, there are huge benefits. First of all, the whole production of hormones that happens in it really wards off postpartum depression. You can't say that, okay, there's not going to be the rare case of the woman who gets it, but most often all those hormones helps to prevent postpartum depression because it's an uninterrupted process. Also, another benefit for the baby is that the baby's microbiome will be stronger because it's going to go through your vagina, because when you go into labor and your body sends all those hormones, it also alerts a bunch of other things. And it alerts your body to produce more bacteria, good bacteria, that it sends to your breasts and your vagina. And so when the baby goes through the birth canal, it's being seeded through your vagina, and it's getting all of those vaginal bacteria all over its face, and then it's going to go, where's it go next? Your chest, because it's going to come into breastfeed. And that is going to seed your baby for the rest of its life. That your baby's microbiome is going to come from that experience. So if you give birth somewhere, or say you have a cesarean, you completely bypass that whole entire process.
You just said something that is quite a revelation, because there are so many people that have a damaged microbiome. So many people that have so many chronic intestinal problems, and that can be a reason why, right? Because so many women didn't deliver this way.
There's an excellent movie called Microbirth out that talks about this very thing. And there's all these studies now that are coming that these children who are born by C-section, what is seeding their gut? It's the OR room. So like in some countries, they wash women down with like a bleach water. Like they're on the table, they're ready to push, and they're cleaning their vagina out with the bleach water, and they're basically just killing all that good bacteria. And that's also sometimes what antibiotics in labor do as well, is that they affect the natural bacteria that's on your chest and in your vagina, and they're killing that off.
Or even bathing then after birth. In the hospital they usually give a bath immediately.
Right, exactly. So bathing the baby is not actually beneficial.
How long should a person wait?
So it really depends, because babies aren't really dirty, and it also depends on the birth. You have the baby that comes out and maybe he has blood all over his head and a little bit of his mother's poop. You can wipe that off. That's okay. But then you have the baby that comes out and it's literally got none of that on it. It just has the vernix, the white creamy stuff, and it's fine. Just rub that into the baby and let it be. I think I I think I took 2 weeks for my first.
Oh,
My
so
second, I took 3 weeks. My third, I was a little busy. It took like, you don't need to bathe your baby right away. It was literally in an alkaline, sterile environment.
Yeah.
So it's not necessary.
I waited also 2 weeks.
2 weeks, exactly. No, it's beneficial because all that bacteria is left on your baby. And the great thing about your body is it's going to keep reproducing the bacteria that's on your breast.
It's also going to build the immune
So
system.
it's going to build the immune system. And so they're finding that children that are born via cesarean have a lot of non-communicable, I can never say that word, non-communicable diseases like asthma, eczema, and diseases like that because their immune systems are not being seeded properly in the beginning.
Extremely interesting. Extremely interesting. What are, in your opinion, the most important and necessary exams and ecographies to do during pregnancy?
This is kind of a touchy subject in the natural world. I actually went to ultrasound school in the States, and most midwives in the States don't do this. I just wanted to have this skill because I worked a lot outside of the US and I wanted to be able to ultrasound. And so in ultrasound school, you know, of course, they're like, yes, pro ultrasound, ultrasound. But then the question comes up, is it safe? And they're like, it's ultrasound. And the question comes up, how accurate is it? And they're like, it's ultrasound. These are sound waves. And the thing is that when you go to do ultrasound, depending on how you hold the probe, everything completely changes. So if you don't have a tech who is skilled enough, then the measurements or the information you're gathering from the ultrasound isn't really that valuable. I would recommend women to get, only if you prefer, an ultrasound at 20 weeks. That's when you do the anatomy scan. That's when you measure everything. After 20
The morphological?
Exactly, that's 20 weeks.
Okay.
Exactly. But after 20 weeks, ultrasounds aren't as accurate because genetics start playing a role. And the baby might not measure exactly the same or might be off dates because maybe it has a tall dad or maybe it has a short mother. And so maybe it's getting those genetics. And so after 20 weeks, ultrasounds are less accurate.
And it's not so necessary unless, let's say, you want to know.
If you want to know,
sex.
Exactly. So in my personal case, I did an ultrasound for my first, very little, and then my second, I had a lot of pain going on, and so we were like, let's do an ultrasound and see what's going on, and we saw that I was having twins, and we were like, oh my gosh, we're having twins, this is so exciting! And then when we went back to do the 20-week ultrasound, we saw that the twin B had passed away. And so afterwards, my husband said, no more ultrasounds for any of our kids, because it was really hard for us to know that we were gonna have two, and then we were gonna have one. And we would have never known that if we would have never done the ultrasound. But it's also good to gather information, like I said, because maybe you are pregnant for twins and maybe you actually will carry the twins on and you need to up your protein intake because you're growing two babies instead of one. Or maybe you wanted to find out about genetic things or other different things like that. So I'm not against ultrasound. I think it's very valuable, but I think doing an ultrasound every appointment is actually dangerous. I'm not excessive with them. I'm not going to do it for an hour long. I'm not like, let's just keep checking and checking. Yeah. We do them very minimal.
And again, you give them also the choice.
The choice, exactly, because we have
Freedom.
lots of people that say, nope, I don't want an ultrasound. Exactly. And we totally respect that.
And what about exams? For example, I know we did hemoglobin or, well, the blood pressure.
Exactly. So it's important to follow your baseline blood pressure because some women naturally have higher blood pressure. And so they might walk in and you could be 130 over 85, but maybe you're that every single day. But we wouldn't know that if you didn't come in somewhere early on. It tells us if you're becoming preeclamptic or eclamptic. It's also hemoglobin to make sure that it's not super low because you don't want to be anemic. We're not excessive with testing here. We can send people to go get a CBC done. If people like it, we offer STD testing.
Gestational diabetes, for example?
So that's also an interesting topic because here we have, we look for the markers of it. So if you're gaining more than 10 pounds in a month, if you're spilling glucose in the urine, which we do the urine every single time, and we're looking for all sorts of things when we do your urine. We're looking for protein, we're looking for leukocytes, we're looking for nitrates, we're looking for glucose. We're also looking at the specific gravity to know if you're dehydrated. So we're looking at all sorts of things in your urine. If that comes back, and say you come back and you have glucose in your urine, you gained 11 pounds in a month, yeah, we might do the gestational diabetes testing. But if if none of those things are coming up as red flags, then it's really not necessary.
And what about vaccination?
Okay, so that's another touchy subject.
Yes.
New Life is a holistic birth center, and it's also a pro-life birth center. And so, personally, I don't vaccinate my children. I have 3 children. They've never been vaccinated. They're as healthy as can be. We've traveled all over the world. We've been to Africa and Haiti, exactly, the Dominican Republic, Central America, Mexico, South America. They've traveled. Yes, my kids have gotten chickenpox and they got typhoid and they got some other things, but they recovered very quickly from all of these things. We don't recommend them here, and so we're actually in a country where vaccines are really pushed on people. And so when we have the typical Ecuadorian that comes in and they're like, okay, when will you vaccinate my baby? Because here at birth, they'll vaccinate your baby for vitamin K, they'll vaccinate your baby for hepatitis, and also tetanus and the flu shot at birth. Yeah, it's quite the load. And
for a small
baby, exactly. And the thing about it is that it's not just the deadened virus or the deadened bacteria. It comes with other things. It comes with aborted fetal cells. It comes with the DNA from pigs, from dogs, from monkeys, and it also comes with aluminum and other things like that. And so it's not like, the actual idea of it, giving your body the deadened virus or giving your body a very small dose of some type of bacteria to build an antibody. It's a brilliant idea. But the thing is that our bodies weren't designed to take in those substances through injection. Because when we're exposed to these things, we breathe them in and we get them in our mouths. And that's how our immune systems are designed. So when we bypass that and we actually give an injection, we are not allowing our body to go through its physiological way to build its immune system. So I tell people, if you want to vaccinate your children, do a delayed schedule, wait until they're after 2, because the first 2 years of a child's life, its immune system is building. And after that, it's not ideal to vaccinate them, but their immune system is built. It knows how to function. It knows it's safer, exactly. It knows how to use its defenses. But it's a very personal choice. It's a very touchy subject, especially right now in the whole world. But case studies show that non-vaccinated children are healthier long-term than vaccinated children. And even Ecuadorians come in here and they say, do you vaccinate? And we say, no. And they say, okay, good, because I noticed with my first kid, I vaccinated, and then they were so sick, and then my second kid, I was like, I'm not gonna vaccinate, and my second kid is barely sick. And their recovery time is faster if they do get sick, because we actually want our children to get things. Like, the child who never gets sick doesn't build its immune system as well. We want them to get the little colds, we want them to get chicken pox, that type of thing, because we want them to build immunity.
But there should be no fear about getting these acute symptoms that are actually beneficial.
Right now in the world, there's so much fear about viruses. Well, we have COVID. And then the issue with COVID is a virus, like a flu or like a cold. And people don't have strong immune systems. So they're frightened about it. But why don't they have strong immune systems? They didn't birth naturally. I mean, this is not for all of the cases, but you have a baby that comes out, it was a cesarean baby, and it didn't have a good microbiome, and then it eats a bunch of junk food its whole entire life. It's shoved full of vaccinations. Do you think that child's going to have a healthy immune system? But I tell people, research. And right now there are some excellent movies out about vaccinations, the damages that they cause, the fudged numbers. There's a huge fight against, it's not so much against vaccines, but against mandatory vaccines, because it should be a personal choice. This is your child and your child's health, and it needs to be taken seriously, because once you put that stuff in, you can't take it out.
You were mentioning films, movies?
Yes, there's Vaxxed, and then there's Vaxxed 2.
Cool.
That are very good.
The mother has difficulty producing milk at the beginning. Is the colostrum just those little drops? Will there be enough for the first days?
Yes, they will, because a lot of people don't realize that your baby's stomach is like the size of an almond. So those little drops, they're maybe little, but they're very powerful, and they're really nutrient dense. And they're designed that way because they are actually full of like amazing things that inoculate your baby. All that bacteria that we were talking about, that vaginal bacteria, the bacteria in your breast, there's even more bacteria in that colostrum. And that's why it's so incredibly important to get that colostrum. It's growing slowly and slowly. And by day 5, it's like this big. But by day 5, you have milk. But your milk is so easily digestible that within an hour and a half or 2 hours, that baby's stomach is empty again, and your baby needs to breastfeed.
That's why we breastfeed every 2-3
That's
hours.
exactly.
I mean, breastfeeding is actually a topic in itself, because no, women don't talk enough about breastfeeding. Even at the hospital, they just give you the baby, deliver, okay, go home. Or we keep the baby for 2 days and then you go home, and then don't talk about it. And unless you have a support group, again, of women that have gone through, I mean, breastfeeding, it's not easy. And I actually understand why some women just bottle feed.
Right.
Because breastfeeding is, you have to want to breastfeed, and you have to put the effort, and your nipples are sore. I mean, I breastfeed, but the first month wasn't as easy as it made seems. Also in theory, like the practical side is a challenge.
But it's so incredibly important. And of course, if you truly can't do it, and if you're having trouble, find a lactation consultant. Like, find a lactation consultant that has actually had kids.
Yes.
Because that makes a huge difference, where you're like, I know you want to cry. Like, I get it. Your nipples hurt. This is horrible. You don't want to go on anymore. Like, you could totally relate. That's part of it.
Yes.
Relating and being like, but you know what? You're going to get through this. We're going to do this together, and you're going to be able to breastfeed, because it's so incredibly important. Because that bacteria doesn't end. That whole process, that it doesn't end. Like, what they find, and we actually posted this really awesome post on Facebook, New Life did, and it was pulled down because it was breast milk from a normal, like a healthy mom, and breast milk from a COVID positive mom. And the COVID positive's mom breast milk was so much greener, and that greener is antibodies for their baby. Because whatever you get, you produce antibodies in your milk, and you give that to your baby. If your baby's starting to get sick, they're crying and they're so clingy, but they're doing that because all of that bacteria that they have, the negative bacteria, they're giving to you, and your body is producing antibodies in your breast milk just from your baby being with you, having skin-to-skin contact and breastfeeding. It's transferring that bacteria to your body, and you're not getting sick from it. You probably already had this, but you're producing antibodies for your baby. And that's why they're so clinging on you, because they're designed to be like that. Breast milk is so important. Of course, if you can't do it, there's, you can get breast milk from other people, but it's just not the same as
the attachment.
The attachment,
Because
exactly.
they connect, they communicate.
Exactly.
I think when he's hungry, I feel like my breasts even lactating. I mean, they're communicating. my breasts, my tits have a brain on their own. And then if you give them formula, I mean, it's cow's milk. It could never be the same as breast milk.
It's mostly never the same, because it's a bunch of, it's dead. Formula is dead. There's nothing in it that's living, where breast milk is completely and totally living. I mean, you've produced it, it's full of antibodies, it's full of everything your baby needs. And as your baby grows, your breast milk changes. Yeah. And it's just,
I've seen some pictures, it's incredible. And again, it's for the health of the baby, and it doesn't mean that it's never going to be sick. But it means that it's going to build a strong immune system. Also, natural hygiene, like, it's not that we're saying that you should be healthy all the time,
right.
But to know what to do in sickness, and especially not being so worried and scared and so fearful about being sick. An acute disease, it's okay, it's normal, it's part of life, it's part of health.
Exactly.
And I guess now I'm understanding how important it is to start properly, to give a proper good start.
Exactly. And it's not only healthy and beneficial for the baby, it's healthy for you. And so, I mean, it's definitely way healthier for the woman. I mean, they're never going to look the same, but you can just let that go. It's a fair warning. I mean, ladies, just accept it.
Any tips on preventing or reducing postpartum depression? before you were saying something that I found really interesting about
the birth process.
Yeah, the birth process. If you deliver vaginally, naturally, you have less chance to...
Right, because the hormones are there. Basically, you get pregnant and you start producing HCG. And it starts rising and rising and rising and rising and rising. And then you give birth. And what happens? It comes down, 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 down. That's the hormone that is produced from being pregnant. And that's not the only hormone. There's a whole slew of hormones that happen. But when you give birth naturally, you're allowing that process to come to a complete peak and then come down. And for some women, there's a dramatic drop, but most healthy women, it comes down slowly. So you have the first 3 months postpartum where you're kind of like, oh, I have my baby. And that's hormones. I mean, that's all it is oxytocin. It's that love hormone. But also, some women consume their placenta. They dehydrate their placenta. They put it in tinctures. And a lot of women, like, it's been a huge thing now for like 10 years. Like, yes, placenta smoothies. Yes, do this. But sometimes it's actually too much. We weren't necessarily designed to have that many hormones. And so women are consuming their placenta and it's making them a little wonky. And they're realizing it, and so they have to kind of come down on the placenta because it's a really delicate process. Being healthy, having a natural birth, and if you consume your placenta, you need to do it in a very gradually and way.
For example, you dehydrate it and you're taking capsules.
Exactly. Like, I think the recommendation from some encapsulators is to take like 3 in the morning and 3 at night. No, that's way too many. I would say start with 1 in the morning and 1 at night. And if you feel like you need a little more, then you can add another one in there. But if you start really high, then it just throws the hormones off. For me, for my first, I took it, all consumed it within the first 3 weeks. And at 6 months, I ended up with horrible postpartum depression. And then by the second child, I was like, I'm not doing that again. And so I consumed it very slowly. And then by the third child, I realized I didn't need it. I actually went and got a hormone panel done after birth. And they said, how do you have such perfect hormones? I mean, you just gave birth. And you're just like exactly where you should be. But it was diet. It was my birth process. It was all the time I spent with my baby afterwards. All of that oxytocin that's produced from being with your baby. You know, you look at it and you're like, it's the most perfect thing I've ever seen. You know?
I know.
and it poops and you're like, oh, I love you so much. That's oxytocin. And so all that time with your baby, that makes you like naturally high and happy. And then also there's support because like you said, sometimes the postpartum period is difficult. And sometimes people are like, aren't you just in love with your baby? And you're like, I don't know. And you need that support. And then there's also fresh air. I mean, there's getting outside. You just don't sit in your house and wallow with your baby because that gets depressing.
Sunshine, I guess.
Sunshine, exactly. The vitamin D and a lot of feeling like they're
natural hygiene, right?
Exactly.
Natural hygiene is that.
All the normal things.
This is natural hygiene. Fresh air, pure water, sunshine.
Exactly.
It's incredible. You're a natural hygienist, and
I don't even know.
Yeah, without knowing it. And what I want to say, and I take this occasion to again thank you so much. Thank you so much for the help you gave me, also to be here and
it's my pleasure.
To help so many women, because I met so many women that you helped giving birth here, and they're all so happy, and I am so happy. And
I'm glad to hear it.
I totally feel blessed, truly. One last question, new life.
Yes.
Your clinics, your project, an amazing project that you want to expand all over the world. What's your mission? What's the mission? Because you're doing it. She's doing this voluntarily. I mean, there is no money to gain here. Actually, she's putting all the money and the effort.
So our mission is basically to bring the best maternity care to low-resource nations. Because you have all these people that want to do good and they go to these nations and they try to help, and I think that there's a lot of good that's done, but to me it's like it's a holistic thing, and I'm really passionate about holistic care because I volunteered at so many birth centers around the world, and to me I felt like that was the missing piece. We go into these birth centers and it's just the same as if you were in a hospital. Yes, they're maybe treated a little bit better, but the quality of care is not there. So that's what we strive for, is to have that quality of care. We want, like when we bring volunteers in, we want them all to be almost at the same level of education, pretty much where they're knowledgeable about holistic things, and we have the same philosophy about birth. Because also, what I touched on it earlier, obstetric violence is huge, and it's something that was just brought to people's attention in the last few years. But it's really, really sad, because birth is supposed to be really empowering for women. It's supposed to be beautiful, it's supposed to be empowering, and it's supposed to be like bonding. And it's not that. And in a hospital atmosphere, it's none of those things. And so our mission here is to bring that, to bring it to low resource places like Ecuador, Guyana, the Dominican, Africa, all of those places. We want to bring them this top quality of care, because all women deserve it, whether you're in Europe or the US, or whether you're in Africa. You deserve to have that empowering birth.
Okay, thank you so much, Morgan.
You're welcome.
I think this has been incredible interview, incredible information. And again, thank you for being here and what you do, because, it's life worth it. Truly.
Thank you, Serena.
Ok ragazzi, per finire, se ci sono due cose che secondo me vi consiglio di portare a casa, di tenere con voi da questa intervista e da questo video, è sicuramente, specialmente voi donne, se volete prepararvi, se volete affrontare il parto, un parto naturale, vaginale, senza antidolorifici, eccetera. Prima di tutto preparare corpo e mente e avere fiducia nel proprio corpo, e questo riguarda anche il periodo di gestazione e anche prima. L'Igiene Naturale suggerisce almeno 6 mesi prima della gravidanza bisognerebbe proprio preparare il proprio corpo. Io so, per me è stato il mio focus maggiore, e infatti non ho avuto nessuna di quelle malattie, di quei sintomi come nausea, vomito durante la gravidanza. Non ho avuto cellulite, non ho avuto edema. Sì, ho messo su peso, ma un peso giusto. Non ho avuto nessuna carenza nutrizionale. Ho avuto un parto naturale, vaginale, senza antidolorifici. Dopo una settimana avevo già perso 8 kg e non ho nemmeno uno stiramento, nessuna lacerazione. Insomma, è stata un'esperienza in salute come io me la sarei immaginata, comunque naturale, normale. Certo, il dolore c'è, ma quella è parte di questo processo. E il secondo punto, come abbiamo ripetuto molte volte con Morgan, e come dicevamo anche con il dottor Giuseppe Cocca, cercare la struttura e l'appoggio che sta più in linea con il vostro pensiero, quindi come voi vi immaginate, come voi vorreste essere seguiti, che potrebbe essere un parto in casa o anche in una struttura come io ho trovato la clinica New Life, che mi ha appoggiato nella mia filosofia e nel mio modo di vedere e di voler affrontare questo evento speciale. Grazie mille per aver visto questo video. Se ti è piaciuto dagli mi piace, se ti piace dare mi piace ovviamente, questo sempre mi aiuta tantissimo a crescere. Iscriviti a questo canale se vuoi rimanere connesso con me, con la mia vita, anzi con la nostra vita, e se vuoi continuare su questo percorso per una libertà e una padronanza e più fiducia nella salute naturale, sia fisica che emotiva. Da Serena è tutto, io vi saluto Morgan e noi ci vediamo presto. Grazie mille, un bacio, ciao ciao!
Ciao!